Everyone. So nice to see all of you here. So I just want to talk a little bit before we start about the program, Traveling the Journey. This was the first program that Alzheimer's Coachella Valley developed for our families, and it kind of epitomizes the philosophy that we have in that our goal was to work with the family unit, was to work with the caregiver and the person with diagnoses and focus on possibilities and opportunities as opposed to totally focusing on the disease. And so Traveling the Journey had two components. The first hour was education, as we are doing today, and the second hour was an opportunity for caregivers to have their support group and people with diagnoses to work with an activity director, meet other folks like themselves, and be engaged and share. Now, unfortunately, because of COVID, we're not able to do the second part of it with both groups. We still have our support groups and we still have Club Journey separately. So Traveling the Journey was really meant, as the title says, to provide the caregivers and those with diagnoses on information to help them on this path that they're traveling. And hopefully it provides skills, resources, information that maybe you don't need it today, but someplace down the road, something's going to click and you're going to need to access a program, a person, and hopefully, and especially now, as Priscilla explained, if you miss some of these segments, or your hard drive gets full and you forget some of it, you can always go to the website and access the videos from before and the information. Or you can always call us at the office and get the information. So basically what we're going to start with today is it's kind of a self-inventory, let's say, for all of us, is planning, having a plan. And I think it's interesting, studies that have been done in the United States, 99% of people that are aging over the age of 65 want to age in place, meaning they want to stay in their own home, which makes sense. And I think probably all of us believe in that philosophy also. And it's a great goal to stay healthy, exercise, have good nutrition, and have good social networking. However, I've been working with families and individuals living with Alzheimer's and dementia since 1991. And most of the time when I meet them, it's because plan A doesn't work anymore. However, they didn't have a plan B. So now they're in a crisis. They have to make a decision. And as most of us probably already know, when we're in crises, a lot of times we don't make good decisions. So sometime in the future, we have to undo what we already did. And that's what this is about, is to hopefully prepare all of us so we have a plan B. So when something goes off course and we can't implement our plan A, we already have choices of what we can do. Now, sometimes this could be a temporary situation. You're the caregiver and you've just been diagnosed with a hernia, or have to have hip replacement, or whatever it might be. So you're going to be in the hospital and then maybe in a rehab. So what happens to the person, your loved one that you're caring for? Who's going to cover that 24/7 position while you're being taken care of? So maybe it's family. Maybe, that is one of your choices, and that's great. But but do you actually have a valid plan for that? What if it's home care? And I'm looking at Jeanette, and because Jeanette's been very proactive and she already set this up. She called a home care agency. She got all the paperwork in place. Her family's all hooked up. So if anything were to happen to Jeanette and Richard needed some care until a family member could get there, she has that in place. And so, you know, that's a nice feeling to have, to know that you've covered that base. Or maybe it's something where you would do a respite with your loved one in an assisted living community, which you can also set up. But the point is that you've done your homework, you've figured it out, and then most importantly, you've let people that will be helping you with this, whether that's the executor of your estate, your powers of attorney, your family members, your healthcare team, all of that information has been shared with people that will be helping you implement that plan. And this leads to the next important thing in your inventory is, do you have all of your legal instruments in order? So if, for example, your living trust, most living trusts have powers of attorney, a will, advance directives, all of those things when you meet with the attorney will be handled, and you will have copies of those for yourself and any of the parties that would be involved in it. So it's really important that you make sure that you have those taken care of. And even when you do that, every 5 to 7 years, you should review those to make sure that things haven't changed, that everything is as you wish it to be. The advance directive is really important because that's what is going to tell people what you want done in case of an emergency, in case someone calls 911. An advance directive specifically addresses, if you were to stop breathing, do you want to have CPR? Do you want to be put on a ventilator? Now, a lot of people, caregivers whose loved ones have an Alzheimer's diagnosis, don't want that. They don't want anything heroic done. But that has to be put in writing. And if any of you have had that done recently, the form, it's called a POLST form, P-O-L-S-T, and it's bright pink. And it's signed off by your physician. And what people recommend is when you get that form in place, that you keep it with your papers, and people know where that is, but you also have a copy of it on someplace visible where if 911 was called, they would see it. They look for it when they come into your home. Most people put it on the refrigerator with a magnet or some visible place when they come into your home. Because if the paramedics, if you have an advance directive that says do not resuscitate, if they can't have access to it, or there's not someone there to tell them and show that to them, then their licensure says they have to go forward with a full code. So they have to admit, they have to start CPR, they have to take you to the hospital. If you're not breathing on your own, you're going to be put on a ventilator. So this is something really important. If that's not part of your legal documents, then that's also fine because that's what's going to happen. But if you don't want that to happen, you need to make sure that it's addressed, that it's in your paperwork, and that it's visible when people come into your home if 911 was called. So Plan B is having a backup plan, having your advanced directives, and then also, okay, so let's deviate from maybe not having to temporarily be out of your home, but addressing the issue of you as a caregiver. I know most of you have heard this before, but it bears repeating. 70% of people that take care of someone with Alzheimer's or dementia die before the person with the illness because of the stress and lack of self-care. So it's really important as a resource while you're living your plan A at home that you cut out time every week for yourself. And whether that is you have a home care person come in for a few hours, whether you access a day program. There's 2 day programs in the Valley, Eisenhower Memory Care Center and Vista Cove at Rancho Mirage. Now, some of the things we're talking about right now because of COVID are not accessible. When I checked with Eisenhower Memory Care last week and Vista Cove, at least at this point in time until June 19th, their day programs are not functioning, but they're hoping that they'll be able to open those up based on, social distancing and those kinds of things. They may be limited to the numbers of people, but you can still get information on it. You can go online and look at it. You can see that Eisenhower operates Monday through Friday, I believe, from 8 until 5. Vista Cove operates 7 days a week. Their hours are more flexible because they're an assisted living community, open all the time anyway. The average rate is $85 a day, and that's for normally 9 hours, includes lunch, 2 snacks, and if they need medications, if they're incontinent, that care is included in that price. So financially, it's a really good resource in terms of spreading your dollars out. And a lot of families do that a couple of times a week. It's good for both parties. It's obviously very good for the caregiver to get some time off, but most of the time, it is a great opportunity for those with diagnoses to make new friends, to keep them stimulated and busy and active. Most of the families report that they love the days that their loved one goes to day program, because not only is it great for them, but when he or she comes home, they've had a great day. They have dinner and maybe watch a little bit of TV, and then they're exhausted. They go to bed, they sleep like a baby, and it's just win-win for everybody. So great resource, and financially, as opposed to home care is like about $25 an hour. And again, that's more one-on-one, where you have a caregiver coming into your home. There's not as much socialization involved in it as a day program. And cost-wise, it's more expensive. But, a lot of people, if your person is not able to get out and be mobile and those kinds of things, home care may be a more viable option for you. So, and remember that Alzheimer's Coachella Valley does have a scholarship program called Breathing Space. Right now, it's not functioning because we haven't been able to do our fundraising as we would like, and there's no monies available for that. But we have quite a few grants out, and we're very hopeful that we're going to be getting more money for Breathing Space. So we want our folks to know, and our families to know, that if finances are a barrier for the caregiver to get some relief, call the office and get the information. Even now, do the paperwork so when the funds come in, we could go forward with it. So that's a really good option. The other thing is respite care. And what respite care is and let's say that you have a family gathering that you want to go to, a family reunion, a wedding, and it wouldn't be suitable for your loved one to go with you. So you need either a safe place for them to go while you're gone for the weekend or a few days, or you need someone to come into your home and be with them. So that's also a service that's available through home care, but all of the memory care communities offer respite care. Now, again, I don't know that they would be doing that right now. You would have to check with the community and see if they're accepting people for respite care. But it is an option in normal times. And each community has a different philosophy. Some people will do it for a weekend. Some people you have to do it for 5 days. Some people it's for a week. And it normally averages about $150 a day. And that includes all of the care that they would need. Their medications, their incontinence, their showering, their meals, their activities, their snacks, and those kinds of things. So that's also an option for something in the future. And, you know, maybe you were having a surgery or something like that, that would be an option. And you can get all that information in advance. Just so you know, in terms of day programs and respite care, in order to access that, you have to fill out paperwork. You have to get a physician statement from your doctor. The person that's going to access the services has to have had a TB skin test or a chest x-ray in the last year. So it's not something where you can decide on Friday, oh gee, I think I'll go away for the weekend, and you pack their suitcase and drive over to someplace. So give yourself, this is a great time to do some investigation and get all your paperwork done. And then if you decide in the future that you want to access that, you'll have everything in place. So that's another option. One of the things that families talk about is when you're doing the plan, what if you don't have financial resources in the future to place your person if they can no longer be at home? There's a program in California and it's called Medi-Cal. Every other state, it's called Medicaid. But of course, we have to have our own program. Excuse me. Medi-Cal, in order to qualify for Medi-Cal, you have to go through a process where they look at your financial situation. So it's kind of cumbersome in terms of you do it through the Department of Social Services. There's a packet of paperwork that you have to fill out. If you qualify for it financially, then Medi-Cal dollars would pay for your person, your loved one, to be in a skilled nursing facility. The way the law reads in California right now, if you qualify for Medi-Cal, they will not pay to assisted living, board and cares, any of that level of care. They will only pay for skilled nursing, which is very unfortunate because our folks don't really need to be in a medical facility. They need to be in a safe setting where they can have care and supervision, and where the staffing is based on the number of folks. In a skilled nursing facility, you're probably talking about a ratio of 1 to 15 or 20 people. And they're really not set up to do the kind of patient redirecting care that you do with memory care folks. So it's not an ideal setting, but when you run out of finances, it's the only option that's available. The other thing is there's not a lot of communities that will accept Medi-Cal patients who have a diagnosis of Alzheimer's or dementia. So it's very unfortunate. There's a lot of families. I mean, the average cost of assisted living care in the Valley is probably $4,500 a month. So you look at that on an annual basis, and you can see how people run out of money quickly because most care is paid for privately. Some people do have long-term care insurance, but that's not the majority of people. So that's why we try to share with the caregivers and families that the more aggressive you can get in accessing community resources like programs at Alzheimer's Coachella Valley, day program, having some in-home care once a week, that defers the placement option of becoming early on the journey. And so if you can defer that as long as possible and be able to stay at home, that's a much more pleasant outcome for the caregiver and the person with diagnoses. So placement in that respect, a little bit in terms of assisted living communities. And, you know, we have all the information on that. If you need information on thinking about that down the line, there's quite a few communities in the Valley. There's also homes, which are called board and care, which are small single family dwellings that usually are licensed for any place between 4 or 6 people. The cost is a little bit less than in assisted living communities, maybe like $3,500 as opposed to $4,500. The concern or the extra caution that you would have to have if you're pursuing something like that is that the staffing tends to be not as well educated and trained to work with people with Alzheimer's and dementia. A lot of the homes are run by families. And so it's, you know, parents and their kids, which is a nice setting. I'm not saying that it's not an option, but it's oftentimes I have found that the staff doesn't have a lot of skill and training in knowing how to work with people that have the needs that our folks do. So that would be something that you would definitely want to, if you were looking at an option like that, either for respite care or for permanent placement, you would want to know, you know, how long their staff have been there, how much training they've had. The state mandates that everybody has to give training to their staff on Alzheimer's and dementia. But the reality is they don't have the staffing to do the inspections. So, you know, a lot of times a home will be operating for 5 or 6 years and nobody from the state's ever been in there. Right now, the state responds within 10 days if they receive a complaint, but they're not on a regular schedule of inspecting. And that would be true for small homes as well as large communities. They just don't have the staffing. And after what's going on right now, they're likely not going to be hiring any staff either. So it's probably not going to change. So when we're talking about placement, Priscilla told you there's a questionnaire that you can get in the office. One of the things that we want to educate you in is being a good consumer and a good advocate for your person, whether you're looking at home care, respite care, day program. So when you actually are doing your homework, there's some really important questions that you need to ask the community, the facility, or the home care agency when you're interviewing them to see if you would, want to do business with them in the future. In terms of visiting assisted living places or skilled nursing or any of those kind of communities, they always want you to call and make an appointment with them. And they would be very unhappy if they heard me telling you this. But, this is my belief. I tell families, don't call and make an appointment, because then you don't know what really goes on there, because they know you're coming. So they're going to be prepared. You want to see what goes on in that community on any given day. And the only way you're going to see that is to show up. And trust me, they're not going to turn you away. They're going to give you a tour. But obviously, you don't want to show up at 8:30 in the morning when they're trying to get everybody up, dressed, and fed. So you would want to come like from 10 to 11:30, or after lunch, like from 1 to like 4:30. They normally have dinner at 5. And so during those hours, and you need, I think it's perfectly acceptable. When I used to own my own community in Palm Springs, I was really impressed when family members came in and had a list of questions and went through them, because I knew that this was really important to them. They were asking me good questions. And a lot of times, if you don't ask those questions, they're not going to volunteer it to you. So, you need to ask them, what's your staff to resident ratio during, the busiest times of the day? How many caregivers do you have for the residents? Is it one caregiver for 5 residents, one caregiver for 6 residents? What is it? And you need to ask, how long, what's your turnover rate like here? How long has your staff been here? What kind of training do you do with your staff? The state says that you have to train your staff every single month, but that doesn't mean that they do that. So, how often do you train your staff? And, what do you do with people? Like, let's say I place my person, and when they move in, they don't get along with some of the people that live here. What are your staff trained to help my person adjust when they come in and get used to the lifestyle here and the routine? Or a week after they come, are you going to call me and say, he doesn't get along with the other residents, so you have to come and get him? Or what's your philosophy on medication? If somebody has a behavioral problem, do you just automatically call the doctor and get something for them? Or are you staff trained to work with people that, get frustrated, that get agitated? Do they know how to redirect them? Do they know their residents well enough to bring up something that's going to take their mind off of what they're stressing about? Those are really important questions. And also, what if my person, the reason I'm placing is because my husband or my wife is up all night long and I can't get any sleep? Is that going to be a problem for you? Do you have staff that are going? The state says that if you accept people with Alzheimer's and dementia, your staff have to be awake 24/7. Because if somebody gets up at night, somebody needs to be there for them. Maybe they just had a bad dream. Maybe they can't find the restroom. Maybe they need a snack. Maybe they just want to talk or watch TV. But those are important questions to ask them. And also, if I place my person here, am I going to be able to have input or communication with you and know what's going on with my person? If there's a change, if when my person comes in, they're not incontinent, but they become incontinent, what's going to happen? Are you going to be able to adjust that? Is it going to cost me more money? You know, those are important questions for you to know, and to know, you know, how do I communicate once I place my person here? What's the visiting policy? When can I come to see them? How often can I come to see them? So lots of, you know, lots of onus on your part when you're thinking about doing this, in terms of gathering information. And another good question to ask is whether the community is owned by a corporation or is it owned locally? Because a lot of times if you're dealing with corporations and corporate policies, it's difficult to get an answer to your question or to have good communication, because everything has to go through corporate. You know, it's nice if you're visiting a facility and you meet with the executive director or the director of nursing, to be able to say, do you have the power locally to make decisions? If I come in and ask you something about my loved one, are you going to be able to give me an answer? Or do you have to go up above to find out what's going to happen? Because that's going to tell you something about your relationship and how things are going to work in the future. So I think I'm looking at my notes here. I think I've covered a lot of what I wanted to, but I want to leave time for you if you have any specific questions that I didn't get to. Priscilla sent me a question this morning from someone that sent it in that wanted to know about what the future looks like, because most of our communities now, if you have a loved one in a memory care community right now, those communities are locked down. Families cannot go to visit. They can FaceTime, they can Skype, they can call, but they can't physically go into the building and visit with their loved one. Now, obviously, you know, things are going to be changing in the next month. Her question was, if the governor, if the county lifted those restrictions and said that we could now go into the communities, is that a safe thing to do for us who are out in public, you know, more during the day, maybe healthier, to go into a community of elderly people that are more vulnerable and more at risk? And, you know, I would say once the communities say that you can come in, that's a decision that you have to weigh yourself on how you feel personally. Maybe if you decided to visit with your person, unfortunately, here in the desert, we're coming into the time of year where being outside is not so viable unless you do it like early in the morning. But, you know, being outside in the fresh air would probably be a better option than maybe being inside with everyone else. But that's a decision and a transition that families are going to have to make. And it's a tough decision.
Thank you, Pat. We have a couple other questions in our chat. One coming from also from Mary. She's asking, at what stage of dementia is someone eligible for day programs? And I apologize if you already addressed that in the talk.
No, I didn't. And that's a really good question. And I think most of the folks that come to, I mean, obviously a lot of the folks that come to day programs are still living at home. So they're still somewhat independent. They're still able to make their needs known. They're still able to respond to questions. They still like socialization. One of the things is it's kind of hard if you bring someone that doesn't want to have anything to do with anybody to a day program, because the emphasis is on, you know, doing things in a social setting. So, you know, doing their exercises, going for walks, having meals together, playing games together, whatever their activity is that they choose. A lot of times it's an experiment. You know, I always tell families, go and look at the day program that you're thinking about. If it's Vista Cove or Eisenhower, they're very different settings, very different operationally. So you could probably tell by going and visiting yourself how your person would do. But understand that most people, when the person with diagnosis, when they're exposed to going to a day program and being separated from you, are never going to say, oh, that sounds like a great idea, I really want to do that. You know, they want to be with you. They don't want to be separated from you. So sometimes, I think most of you have heard this before, but there's a saying in speaking Alzheimer's, therapeutic fibs. So sometimes it's not beneficial for the person with diagnosis to tell them in advance what you're doing, because they're going to get all frustrated and they may just dig in and say they won't even leave the house with you. They won't get out of the car when you get there. So a lot of times families will just say, let's go on a ride and go someplace and have lunch. And so you can arrange it with the community to just show up there, have a snack, do something, and then the staff will get involved and you can just gracefully. Sorry,
you've been talking a lot.
Yeah. I always tell families, you know, give it a try for a couple of weeks. You'll probably know if you go and visit whether it's going to be beneficial or not. I would say 75 to 80% of the time, it works out because the staff are used to helping someone adjust and adapt to the situation. Especially if you can kind of hook them up with people that have the same interests they do, where they can share and talk and those kinds of things. Because then it's more like a social, it's like going to a club instead of, I wouldn't use day program when you're talking to people with memory loss, because it reminds them of, you know, going to kindergarten or something. And it's not dignified for them. So I would just say, you know, a lot of families tell their person that there's a community center that needs volunteers. So I know at Vista Cove, some of the people that come there think they're coming to help the people there. So, and they do. They help the staff set up the activities, they set up chairs, they take out trash to the dumpster. They help set the table, they help clear off the table. And so, you know, they'll say to their person when they pick them up at the end of the day, you know, I don't know what those folks would do without me, because I really make a difference. And so it makes them feel good because they feel like they're contributing.
That's awesome. Pat, our next question is from Sandy. She's asking, can you explain the role of an ombudsman? How effective do you find them to be?
That's a really good question, Sandy. An ombudsman is an advocate for the elderly who are living in communal situations, whether it be a small board and care, whether it's a skilled nursing or an assisted living. These are trained by the county. And so what they're looking for is, when they come into a community, what do the residents look like? Are they clean? Do they look like they're being cared for? Is the community clean? Are the safety measures in place? Normally what they'll do is they just show up. They don't call and tell you they're coming. They'll just show up, and they've already come and introduced themselves, that the county assigns one of them to like 5 communities. And then they might visit one community each day, or they might do them all in one day. But they will go in, they'll talk to the residents, ask them what's going on, how they're doing. They'll talk to the staff. They'll walk through and just look at everything in general. They'll normally check in with the executive director to see if anything's going on. Sometimes they may be coming because they've gotten a complaint. Excuse me. And when they've got a complaint, they'll normally meet with the management staff to talk about what the complaint was, to see if they can shed any light on it. But then they will talk to the people involved and to the staff. They'll go back and then they'll make a report. But the whole point of the Ombudsman is to safeguard our folks in these communal living situations, and to make sure that what the state is holding them accountable to is being done. So as to are they valuable, Sandy, it basically depends on the person. Some of them are very fastidious and really caring and wonderful to work with, and some of them, you know, they shouldn't be doing it. And so it's a matter of you communicating with them. If you think that they're not fulfilling what you would like them to do, their office is right in the Regional Access Program, which is on Hovley and Cook Street. It's a 2-story building. The Ombudsman's office is in there, and their supervisor is a woman, Mary Jane, who's been to our office before. So, you know, you could always call, and as a provider, you could say, you need to give us someone else because they're not doing the job. They don't know what the job is. And, you know, it's not of benefit to us. But they have posters in every community, an Ombudsman's poster with a 1-800 number on it, a staff person, a family person, and in some cases, a resident. They have the authority to call that number and make a complaint. And then the Ombudsman would come and check it out, and then they report to licensing what's going on. So it's a communication, it's a compliance, but it's only as good as the people that are performing it.
All right, thank you. Also good information. Now our next question, Pat, is from Mary Lou, and she is asking, has COVID-19 impacted a medical directive of no resuscitation that's in place, and yet there is no possibility of recovery? Is that
well? If you have a DNR, they're going to honor that in COVID. If you don't have a DNR, then they have to do what they have to, you know, their licensure says if they come upon a person that's not breathing and there's nothing to tell them not to resuscitate them, they have to do a full code on them.
Question? It's Mary Lou?
Go ahead,
Yeah.
Mary Lou.
That wasn't worded very correctly. I guess my question is, you have the DNR in place.
Right.
The individual's elderly. They didn't expect to get COVID, and they don't have multiple system failure, but the DNR, I mean, is there any question that they could be resuscitated, and that order is temporary? Do you follow what I'm saying? Let's say there is a chance for recovery and they have a DNR and it hasn't been changed.
Then the DNR would be implemented.
Okay.
So the only way they can deviate from that is if the DNR were to be changed. I mean, if you have a power of attorney person or someone else that wants to, you know, make a change in that at that time, then they would have to actually change it. Otherwise, they're gonna honor whatever on paper at this time.
And is there any question about when that decision, you know, with that multiple organ failure, isn't there a stage at which they might be brought back and they'd have to have that changed? I mean, what do
Well,
people?
that would be up to the family and the individual. I mean, if the individual is one of our patients, if it's an Alzheimer's dementia person, then the power of attorney is already making those decisions for healthcare. So that
Okay.
person would have to step in and do something if
All
they
right.
wanted to change it.
Okay. In an emergency kind of situation.
Right.
Thank you.
Thank you, Mary Lou. Pat, our next question is from Mary Kay, and she is asking, how do you find community dwellings, the ones you referred to? What if someone lives alone, is developing dementia, refuses to leave their home? How would you find and vet and live-in caregiver? So I guess that's two different questions. So if we're looking for alternatives to the big residences, and I think this might be something Dom addressed last week. So I'd just say, also, if you're interested, check out our YouTube channel and our website for the video that Dom and Mindy Calvano did from Custom Care Solutions. But Pat, if you could maybe address that.
First of all, and this is a situation that comes up a lot of times these people that are living by themselves and don't have any family around have nobody that has legal authority, power of attorney, any of those kinds of things. So it becomes very challenging and very difficult when people around them notice that it's not safe for them to live alone anymore.
Oh, sorry.
It's like Jewish Family Services, senior advocates, where a neighbor could call them and say, I'm very concerned about my neighbor. I've talked to her, but she's not willing to, or he's not willing to listen. However, I've observed that it's not safe for them to be alone. You can give them the person's name and address. They'll send a social worker out there to assess the situation. However, the person still has the right to not talk to them, to slam the door in their face and, say they don't want to talk to them. So it's really difficult in those kind of situations unless you can find somebody that actually has some kind of authority or some kind of an instrument like power of attorney or a child or a relative. But if they you could always try Jewish Family Services. You could try Senior Advocates of the Desert. If the person's amenable to looking at placement or home care, there's organizations, there's placement agencies that can help with that. Assessing their financial resources, what would be most appropriate. And then home care can be accessed, by the individual or people helping them. Again, a lot of it depends on the individual, and if the person has any form of dementia or Alzheimer's, they're more than likely they're not making good decisions. So then it becomes really difficult. But they could call our office. We could help them set up some resources to look at it.
Right. Well, so we do have brochures for placement companies and in-home care. Would some of the questions that you're asking those companies be similar to the questions that you would use in communities? All right. And I think I have one last question. And again, you might have addressed this already, Pat, when you were talking about Medi-Cal. And the writer has been in a class before, and she thought she remembered something about legislation favoring SNFs, and that there were people trying to enact some change in that. And do you know the current status of that situation?
An SNF is a skilled nursing facility. It's just an acronym for that. Unfortunately, in California, I told you the law is that if you qualify for Medi-Cal, they will only pay to skilled nursing facilities. They won't pay to assisted living. Now, there has been legislation brought up, bills brought up in the past, but they've never gotten to the governor's desk. And the legislation that they're trying to pass says if you qualify for Medi-Cal, you can use those dollars any way the individual, the family, or the physician decide is appropriate for that person. So if it's assisted living, they would pay those dollars to assisted living. If it was a small board and care, they would pay there. If it was in-home care, they would pay there. If it was skilled, they would pay for that level of care. The problem is whenever it comes up in California, the skilled nursing facilities, even though they don't like having a lot of Medi-Cal beds in their community because they don't get the highest dollar reimbursement, they don't want the assisted living industry to get in to the Medi-Cal dollars. So what they do is they send all their lobbyists to Sacramento to lobby all the legislators and the governor to say, no, 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 you don't want to change the law. So until the assisted living communities, there's a lot of professional organization, California Association of Assisted Living Communities, but they've never gotten enough power and pressure on legislature to get it before on the governor's desk. And in actuality, the value of those dollars would be better spent in assisted living than in skilled nursing. Skilled nursing is much more expensive. And like I said, skilled nursing is not appropriate for our folks. Most of our folks are physically very healthy. Their problem is, you know, they need care and assistance with activities of daily living and safety measures. And they don't get that in skilled nursing anyway. The staffing is such that if you're taking care of 15 people and you have to shower them, get them dressed, get them to the dining room, toilet them, those kinds of things, they're not getting the kind of care that our folks need. So it's a shame, and you know, families need to get more proactive. I think Ruiz's office would be a good start if you wanted to go and, you know, advocate with them. And now a new person was just elected to Stones. She's from Temecula. I can't remember her last name. Anyway, there is someone in Stone's position now, so there's actually two people that you could go to, but it's basically gone nowhere. And you know, it's a shame because California, of all the states in the United States, with the number of people, 40 million people, and 6% of that population is over the age of 65. 500,000 people in California live with Alzheimer's and dementia, and we don't have a Medi-Cal waiver that covers anything other than skilled nursing for our people. So it's a shame.
It is. Pat, Helen has a question about paperwork for respite stay. And Helen, I just took you off mute. Do you want to ask that of Pat?
Yes, can you hear me?
Yes.
Yeah.
Okay. Pat, you were saying that it would be a good idea to get paperwork and TB test or chest x-ray in advance, which I would assume would have to be kept updated every year with your doctor and the.
Right.
But does each, do you have to pick your facility first because it's their paperwork, or is it generic?
The physician statement is pretty generic. We could get some of those, Priscilla. I'll ask Brian at Eisenhower Memory Care and Jack at Vista Cove to get some of their physician statements. We could have some. that's the most important thing, Helen. Everything else, the other paperwork that would go along with that is specific to the community you choose. But if you had the physician statement in hand and the TB or chest x-ray done, if you decided that you needed respite next week, you could call, you know, Vista Cove and say, I have my physician statement ready. If I meet with you and sign the paperwork, can you do that? And that would be doable in a very short period of time.
And so with that, I would just keep that. I'd ask the doctor to
Yes.
update that every year and do the TB test every year.
Right.
Because I was thinking more about emergency hospitalization or something that you wouldn't know, and so you'd want to keep that.
Right.
Thank you. Thank you.
Okay.
Thanks, Helen. Are there any other questions? I'm going to just scroll through your little faces here. Like I said, you can type something in the chat, or you can hold your hand up, and I will unmute you. I want to thank Pat Kaplan again for joining us this morning. Such a wealth of knowledge. Really has just been, Pat, you've been talking for nearly an hour now, and it's all really great information. And again, this will be available on our website, probably by Monday or Tuesday. It'll be available on our YouTube channel. Please go search Alzheimer's Coachella Valley on YouTube and subscribe to our channel. And that should be later today or Tuesday at the latest. I keep forgetting Monday is
Monday's a holiday.
Yeah.
And I just want to say thank you all for attending, and just know, you know, if there was something that wasn't covered today or you want to talk one-on-one, just call the office. If I'm not there, Priscilla will text me your number and I'll get a hold of you.
And again, if you'd like the handouts for today and you haven't received them yet, call or email me or message me and I will get those out to you. But again, thank you all for being here today. Thank you, Pat.
Be well, be safe.
Have a great holiday weekend, and we look forward to seeing you next week.
Thank you.